So we're trying to give a perspective of all the ways that I can manage congestion during post, status post, 18 months out. And I always will come back to the simple and lowly VooDoo floss band. This is a larger width floss band, but whatever you have is appropriate. And starting about $10 is completely a great way to go. Now, anytime we're messing with compressing a joint that has an incision, we're just always trying to say, hey, is this compression going to push swelling out? Am I going to see fluids leak? If it's not leaking anymore, then that swelling is probably appropriate. It'll take a couple days, or the compression is appropriate. But really what I want to show you here is all I would do is get a little bite on the tissue, and it doesn't have to be freakishly tight. I can wrap at an appropriate level. Any compression is going to feel good. If I wanted to go really tight, I certainly could. My tissues will take different levels. All I'm doing is doing it about here, about maybe 20% tension, not super tight, and then just a little bit about 50% overlap. And then I just tuck this in. Now, traditionally when we VooDoo floss, we're doing a lot of motion in the tissues. We're flexing and extending, but I might not be able to do that. So even if I just had some compression here intermittently, and I never have numbness and tingling, I never feel like I'm occluding the system, but this maybe give me some input where I'm not afraid to touch my leg. I can do some gentle movement of the tissues while I'm doing this. I'm just getting some rocking here in that whole kind of fascial sheath. I'm just getting that circumferential mobilization just to keep tissues moving. I can be flexing and extending while I'm doing this, doing my regular quad sets. And after about a minute or so, I would pop this off and then give it a break. I could even go with lighter compression here. It was like somewhere sort of 10 to 20%. And I could even elevate, be on my back and elevate and wiggle my toes at the same time. If I had swelling down in the leg that had fallen down, it would be appropriate for me to push that up. Wrap the ankle, wrap the shin, wrap the high shin, wrap the knee. I could keep kind of pushing that swelling up out of the system. And what will happen is all of a sudden, I feel like, oh, a minute's gone by, I'm gonna pop this off, and you can see that blood flow is gonna come crashing back in here. So if I have altered sensation, can't feel my foot, nerve block is still in, I'm probably not going to do any kinds of compression because I can't tell what's going on. But the idea here is, hey, low level, moderate compression with the VooDoo band, wrapping on and off multiple times a day is very, very safe and very effective. We're not occluding anything. So the only thing I would be aware of is potentially you may need to wrap over the bandages, totally okay. Any compression in the system, so if you had shoulder surgery, any compression in that system is going to work. If you have a latex allergy, just heads up about that. These are made of latex. And then typically when we have an effused joint, so for myself, traveling into the wilderness, can't bring my toys with me, I always bring a VooDoo floss band. And my rule of thumb is 10 times a day gets you a C. So if you don't have any of these other gadgets, they don't fit into your budget, I know you can work out a VooDoo floss band and sort of, just systematically compress, wrap, unwrap, and really get a lot of work done. We've seen ankles that are swollen that have gone from looking like gigantic grapefruits back to regular ankles. We can get a lot of compression in the system mechanically that does change the tissues. And 31-minute sessions a day is a ton of compression versus sitting there and hoping passively that the tissues sort of manage themselves. Remember, they're giving us a ton of quad sets, flexing the quads, squeezing the ball, moving the foot. That is baseline minimal movement to prevent these DVTs and to get some movement going. But for us, if we can get some more compression, more movement of safety, then we're gonna see that the tissues really respond in kind. So a VooDoo floss band, I would say is a must-have if you're gonna follow our program to help stay on that congestion. And then again, I still use it months afterwards when I've loaded the crap out of my knee and I still quite haven't hit that 18-month mark. I'm still gonna get some effusion. This is a quick and easy way for me to wrap that knee, manage that swelling without having any of these other devices.